Now, quickly looking at the next type of orthosis, and this is the cervicothoracic orthosis. Cervical, that's the one that is actually placed around the cervical vertebrae. The thoracic, so from the cervical vertebrae down to the thoracic vertebrae, this is where you place this orthosis. So it's basically anything that will help to put this part of the body in one place so that I can heal. So it's just a specialized spinal brace, and it's designed to what? Keep that part of the spine in one place, so to say, immobilize. Okay, so it will now support the cervical spine and the upper thoracic spine, you understand, so that it is stable and there's no anyhow movement, so that that part of the body can heal. So it extends down to the chest and the upper back to limit motion in multiple planes. So purpose is to stabilize the neck and the upper thoracic spine after there's an injury or surgery. So it controls flexion, extension, lateral bending and rotation. If you put it there, the person will not be able to do all these movements. So it will keep the place, that's the neck down to the upper back in one place, so that I can heal. So indications, reasons why you might actually want to use this cervicothoracic orthosis is when there are traumas. So any trauma that is affecting the cervical vertebrae or the thoracic vertebrae, you have this. They also have post-surgical support, probably after a surgery. So you just want that place to be in one place to heal. Then also degenerative conditions like arthritis and the rest of it. Then tumors too, and also infections. All of that, you can be using this to basically arrange it. So designs and components is cervical components, so they are similar to the rigid cervical collar supporting the neck. This is kind of like cervical. I've not seen the back though, but the real cervicothoracic one is from the neck down to the back. You understand? Yeah. So the cervicothoracic has a thoracic extension, so it extends to the chest and the upper back. Of course, the lower back is the lumbar region. You understand? So often with anterior and posterior parts, they'll have the straps and pads where you can basically use them to wrap around you to keep them in position. So materials is actually, it could be made up of lightweight plastic, foams, and sometimes metals. So benefits, it will help to keep the part of the body in one place so that it can facilitate you healing faster. Can be adjusted for comfort and also fit. So that's what we have for the cervicothoracic orthosis.